Thoughts on mandating the COVID vaccine? Let's get into it. You know, sometimes I have super strong opinions that are really straightforward, and I don't have much waffling back and forth about it. Is this the right way to feel? Or is this, wrong? Or how do I feel? Whatever. And then there are topics like the COVID vaccine mandate that a lot of employers and schools are enacting, and now even like cities to go to social events. And my feelings here are a little bit muddled, which is personally very confusing and annoying. And a lot of you seem like you're feeling the same way. So I thought we would talk it out, or at least I'll talk it out, and maybe you can just like nod along. Just sit there and nod along, or maybe you'll get really mad at my opinion, or maybe hopefully you'll see a side of it that you hadn't really thought about before. And as always, you are very free to share your own thoughts on anything we talk about down below. And I think it would be really nice if we could discuss this really civilly, because this is not a black and white issue. Nothing is, but we somehow have kind of forgotten that. And that's okay, we can come back from that, but there's a lot of gray in this area, and understanding that other people's gray looks different than your gray is going to really help us come along and understanding, the different things within that gray. Like, what is giving you the reason to think that way? I think if we can all talk about that and understand it, I think we would come at this with a lot more compassion, and we wouldn't be in the state we're in. Okay, so I thought in order to make this a more balanced discussion, I would do kind of a list of what I view to be the benefits of, we're just gonna look at really employers requiring the COVID vaccine. And within that, talk about healthcare companies requiring it for their staff, because again, that is my primary market. But the ideas are generally the same across the board. And as I've already mentioned, I do have mixed feelings about this. So we will dive into, after kind of the pros of why I see why it's a good thing, kind of some of my reservations. So to start with, the benefits that I see. So getting the COVID vaccine has been shown to reduce hospitalization and death in individuals who are vaccinated. And while the Delta variant has decreased how effective it is in terms of being able to just catch COVID to begin with after you've been vaccinated, data is still showing that it looks like you're going to be less likely to get COVID and contract the illness if you have been vaccinated. It's not perfect, but that's kind of the trend the data is showing us. Now, as with all things in science, this can change depending on, what the variant does next, what else pops up. But right now, the vaccine is still keeping people alive and helping reduce transmission compared to the non-vaccinated group who have COVID. And if you want to learn about how the vaccine kind of works, I have a video that I will link down below that you can go check out there. So let's first look at this in a very non-emotional way, because this gets very emotional. So let's just take it down to the numbers and look at it from like a monetary perspective. If you, as a hospital, had a way that your employers could be less sick, miss less work, and transmit disease less to the patients that are in your hospital, and it was free, and it had minimal side effects, and it was FDA approved now, would you have your employees do that? And I think you would, because in your analytical mind, you're thinking, okay, people will be out of work less, and then there will be less lawsuits from patients coming in and then suing because they came in for a broken femur and then the staff member gave them COVID. And before we go on, I know people are going to say,
but Liz, you are so dumb. Obviously, you need to do more research. Don't you know that you can still get people sick with COVID-19 even if you have been vaccinated? No wonder you chose to be an NP and not a doctor. You are stupid.
Thank you, Karen, from the comments section of every video and TikTok I make. I did know that, and I appreciate you taking the time to ask this question. And you're right, you can still transmit COVID even if you have been vaccinated. It didn't really used to be the case as much when we were dealing with the Alpha variant, but since loads and loads of people weren't vaccinated to COVID, COVID got to infect a lot of new people and make so many virus babies. And sometimes when viruses are making virus babies and they're replicating, the virus doesn't copy perfectly. It doesn't, make an exact copy of itself. And after a few rounds of that happening and a few errors coming in, we get an evolved COVID baby, and we named it Delta. And the Delta is way more contagious than the great-great-grandmother Alpha. And while vaccines are holding efficacy in that they still provide a greatly reduced chance of being hospitalized or dying after you've been vaccinated. And keep in mind, like while you are ill, you can spread it. But if you've been vaccinated, you're still less likely to get sick overall from it. Therefore, you're less likely to spread it just because you're less likely to get sick and you're sick for typically less time, but you do carry the same viral load when you are ill. So that is very true. So is it perfect? No. But from a numbers standpoint, you are still less likely to get COVID and accidentally infect your coworkers or patients if you are vaccinated. You're again, less likely to take sick days, and all of those things look really, really great to businesses, AKA healthcare in the United States, which is absolutely all about money. So next, let's look at the ethics in favor of mandating the vaccine. I don't think anyone watching this wants to give someone COVID or any infectious disease. And the problem here is you can transmit COVID even if you don't have symptoms. And maybe you'll have an asymptomatic infection and you won't be showing signs, but you could still get people sick. And if I were sending my loved one into the hospital, the last thing I would want would be for them to get COVID while they are in the hospital. So any measure to reduce that risk would be beneficial. Let's play out a scenario in your mind. Can you imagine accidentally infecting one of your patients and then having them pass away from COVID complications? I cannot even think of that without being feeling ill. And I've run through that scenario so many times. When I was seeing patients in my office, I was constantly worried that I may be accidentally spreading it. And that was despite me wearing an N95 and being vaccinated. Just how horrible would that be if you felt if you did that and you weren't vaccinated and you spread it to someone and they died and you had to live with that fact that might not have happened if you were vaccinated. I would always wonder that personally. And I'm not saying this to be a fear tactic. I'm just saying their family might also always wonder that as well. And the hospital might come to you for that. They do not want to accept liability because even though getting vaccinated doesn't eliminate your ability to get COVID and spread it, it does reduce the chances, as we know right now. And as a healthcare provider in a patient-facing role, I can absolutely see why hospitals mandate it because your job is to heal people and reduce harm in any way you can. And getting the COVID vaccine does reduce your chance of harming people. This doesn't even come back to you necessarily. Does it benefit you? Does it benefit others? Now, on the flip side of that, you do have autonomy and choices. And the thing with this though is you may just not like the choices, but you do have them. And if you decide that you don't align with the idea that the vaccine is reducing your risk of getting or spreading COVID, or that it doesn't make sense for you and your body, that is your choice. But you then lose the choice of remaining employed at that institution if they aren't putting out that mandate. And that does sound harsh. That's drawing a line in the sand that's black and white in a gray situation. But it's not forcing you to do anything. It is forcing you to make a difficult decision, for sure. But it is not forcing you to get the vaccine. And I get that you need your job and that I absolutely sympathize with that. I really, really do. But I also just think in the end, our jobs are to reduce harm to patients and to get them better. And I think ultimately it is the right call to enforce a vaccine that does just that. But as I've said many times, I do have concerns about this whole thing, which we'll get to. But before we do, we'll just look at one more thing in that why this makes sense to me column. The whole practice of requiring vaccines and testing to see if you're immune to things and then requiring a vaccine, it's not new. To work in healthcare or to attend a lot of colleges, you have to show proof of a ton of immunizations. And you cannot work there or go to school there without them. And that's to protect the patients and the students around you. It's not for you, it's for them. They want to reduce the spread of infection in their institution so they don't have any as much liability of causing harm, and the people can come out hopefully healthier than they came in. Because insurance companies, they really hate that when the patient comes in for something and then you give them something else. It's not a good situation there. And I get it that this vaccine is new compared to others, and that this wasn't how things were when you started your job. But we can't abide by pre-pandemic rules in a pandemic. It just doesn't make sense. We have a new vaccine, so we have a new requirement. That's just like the others. It's aiming to keep patients and staff safe. Just like when you started working there, you made the choice that the initial vaccines were okay to get. And you had a choice again, if if you didn't want to get the varicella vaccine for chickenpox, if you needed it, then you would have had to look for a different job. You wouldn't have worked there. And if this one is not aligning with you, then you'll need to look for a different job. You shouldn't have a problem getting a job. I obviously know you don't want to, but like they need nurses everywhere. You'll probably even make more money than you're currently worth. It's probably even worth just checking out either way, honestly. But thinking the whole like, oh, they changed the rules, that's not fair. Instead, perhaps think of it like this is a business that honestly does not care about you at all, which sounds really rough, but it's true. Their bottom line is money, and they have always made and changed the rules. Sometimes it's big rules like, hey, you need this vaccine. And sometimes it's little small rules like, hey, you can't park here anymore. Hey, you can't have a coffee machine in the break room. Or now you need to document every 15 minutes that you looked at your patient and what was their facial expression. Employees don't make the rules, and there is nothing that says those rules of employment can't be changed. So it may not seem fair, but it is allowed. So I think going at it from the angle of like, oh, it's not fair, at the end of the day, like it doesn't matter because you're not the employer. All right, so now those are some ideas of like things that why I like the idea of mandating the vaccine. Now let's look at why I don't love it. Across healthcare units and clinics, pretty much everywhere, they are so short-staffed, particularly in the hospital. And I do not work bedside anymore, but from everything that I have heard from you and my friends, it is just a complete disaster in the hospitals right now. And especially with like nursing staffing, everyone is taking travel contracts. They're leaving their jobs, understandably, because you make bank. And as we mentioned, go find one of those contracts. And hospitals do not care the most about their employees. So nurses are like, screw you, you have no loyalty to me, I'm just gonna go follow the money. And a lot of nurses have also gotten so burnt out that they quit. Like the entire profession, they just quit. And what are we gonna do if more nurses quit because a COVID vaccine is required? Like, how is that even going to work? I'm not gonna lie, I would probably be jumping ship right now too if I was facing a second wave of inpatient COVID as a bedside nurse. I did one wave outpatient and I was beyond burnt out. Like, just from outpatient dealing with all of the, harassment and just the whole situation. And I cannot imagine being bedside for round 2 and then having to take more people away. It just doesn't, like, it already is unsafe. And now you're just like, how can it get more unsafe? It's just taking a terrible situation and making it even scarier. But also at the same time, you don't want to increase the risk. So then it comes down to like, where do you find the balance there? How do we support nurses and get the staffing that they need while also protecting the patients to the best of the ability that we have, which is to get vaccinated? It feels like impossible. Both ways are unsafe for patients because on the one hand, you have an increased risk of exposure. But also if you remove more nurses, people will die because nurses are already stretched too thin, and then you can't keep stretching that staffing without consequences. And people will die due to medical errors because the nurses cannot do it all. So then we have to look at it as which one would cost more lives and long-term complications. And I really think that removing nurses would cost more lives and cause more complications, because we do have masks. And what if everyone wore an N95 all the time to reduce spread? Maybe that would be decent enough to keep the staffing, have them wear the mask and they have a lower risk of transmission and getting it at least while they're at work, and then versus like vaccinating. And that's kind of where I lean to it. Ethically, I think it's the right thing to do, but does that actually work in the real world? Because ethics are often in a vacuum, and this is real life. And real life is a lot more messy and gray than, just on paper what makes sense. So that's kind of where I left off. That's where I am in my thinking about it, but I would love to hear from you, nurses who are working out there right now. What would you rather see? Mandated vaccines and safety, that way despite maybe losing staff, at least everyone you work with is vaccinated, or working with nurses who aren't vaccinated, which poses maybe a higher risk to you, but like does give you more staff. I would love to discuss it, but let's keep it civil. I won't delete comments that like I disagree with, but if they're rude, I will. I know we can have a civil conversation. And I'm sorry if you're facing this decision and feel awful over it. I am sorry you are working, if you're working bedside and you're terrified of losing more staff. And I'm sorry that as a healthcare community, we have totally forgotten how to have civil conversations and educate in an effective way, which why aren't we educating people at the hospital? Like if there's so much vaccine hesitancy, like let's just hold an in-service and educate people. But some hospitals are doing that and it's great, but a lot are not. But I really do think it would just be so much better if we could just communicate effectively and straight to the point and trust the public with information, and then remove the politics, remove the BS, and just communicate healthcare education effectively rather than making it so much more complicated and inaccessible like it is right now. Like to read a journal, you have to buy the thing, and it's just, everything is so much harder than it needs to be. I hope we can have some good chats. Thank you for listening to my thoughts, and I hope you keep an open mind to the comments that you see down below as we continue discussing. I hope you have a great week. Stay safe, and I will see you next time. Bye.